This webinar is going to be recorded. And I would like to share with you some important welcome notes. So because this webinar is being recorded, if you are not comfortable of yourself being seen or heard, you can definitely switch off your camera. But we prefer to see the audience. You can write your name and organization in the chat just to know, for us to know who is around. And you can pose your questions anytime in the chat, but because we have a lot of persons online, we are going to receive the questions only in writing, and we are going to pick them up after each presentation and at the end of the introduction of the different inputs. Recordings are stored at this address, and each of you, because you have registered, we receive the recordings and the outcomes of this webinar in your inbox soon. And you will receive also in the chat the evaluation form as soon as this webinar is going to finish. So for some of you who don't know us, because I saw there were a number of people who are from our network, but also a number of people who are not from our network. We are EUROPARC Federation, and we are the largest and oldest protected area network in Europe, founded 51 years ago. Last year, we celebrated our 50th anniversary, and we have 400 members in 38 countries. We have the vision of sustainable nature valued by people, and we represent our members in different venues, political institutions. We support them through activities and programs, including through commissions in different technical areas that you see on the slide. So today we are going to speak about health and biodiversity, but we also have areas of climate change, agriculture, youth engagement, sport, cross-border cooperation, and the like. We have 8 national and international sections, and we have offices in Regensburg, where I am sitting now, which are our headquarters, and one in Barcelona, and some staff working from other countries. That said, I would like to get the pulse of who you are and where you are connecting from. So we are sharing a Mentimeter in order to see where we are connecting from, that or which kind of organization you are. If you go on, just thank you. So you can join from your browser or from your telephone, menti.com, and connect with the code 73540276. And yes, I guess it's you will see a dot and you can move it with the cursor just to have a feeling on where you are connecting from. I realize that most of European countries, pretty much 99% of European countries, were present in the registration, and also some people from outside Europe. So that gives us a little bit of a glance of where we are and who we are. So I see a strong presence of 5 from maybe Croatia, or Slovenia, who were very quick. United Kingdom, Italy, Poland, Spain, Portugal. Good morning, all. So far, 57 people have located themselves. So I think quickly we could 60 people. So maybe we can quickly move to the next question. And we will share it later with the recordings, no problem. So as I mentioned, EUROPARC is the network mainly protected areas network. So we would like to know if most of you are from protected areas or public administration body, not for profit, and which kind of audience we have today. Because our webinars are open to members and non-members, and some of our members are actually not protected areas. For example, the National Research Council of Italy or the Generalitat Catalonia who are speaking today. So public administration body so far is prevalent, but we have also a few protected areas responses. We are waiting a couple of minutes more. So as I mentioned at the very beginning, this webinar is organized by HPHPe Healthy People Europe program, which is a program that has been initiated and implemented by EUROPARC Federation, and this program is run by a commission who is our technical body and its strategic body on the topic of health. So before giving the word to Peter Rawcliffe, who is our chair of HPHPe Healthy People Commission, who will give you a few words, I would like to check with you, what do you know, or actually if you are familiar with the activities of HPHPe Healthy People at all? And then after this, I will give the word to Peter Rawcliffe, who is our chair, and who will give a few words about HPHPe before our guests start their introductions and their presentations, which are very dense and very interesting. Really, I'm excited. More than a third don't know about it, so good that you are here so you can get to know about it a little bit more, and then you can also find yourself get more information. Okay, so if we are, I think we have enough people, so I will share my screen again and give the word to Peter Rawcliffe, who is going to speak about HPHPe.
That's great. Morning, everyone. Sorry, but I can't be with you visually today. I'm travelling with work at the moment. I'm in Galloway, which is in the southwest part of Scotland, and the Wi-Fi connection isn't very good, so you'll just have to hear my voice. So I hope you can all hear me. So I'm Pete Rawcliffe, as Anna said. I chair the HPHPe's Healthy People Commission. Until recently, I was on the board of EUROPARC Federation too, but my time is over. Really pleased to be here with you today, and thanks to Anna and colleagues for setting up the webinar. Really looking forward to the presentations too. It's a quite a traditional sort of agenda that the Commission's run for a number of years. I'm going to say a few words about Healthy Parks, Healthy People Europe, and then we'll get into the meat, the 2 case studies presented by colleagues from Catalonia and Italy. There'll be time for questions after each of the case studies at the end, hopefully, and we'll take it from there. So next slide, just to introduce HPHPe. As Anna says, it's a program of the Commission. We launched it in 2020 in the aftermath of COVID-19. Seems a long time ago now, but I guess that was the sort of high point of that recognition of the need for connection with nature for a whole range of reasons, but one of those was around health and well-being. And HPHPe has a much longer tradition, dates, probably predates, but came to the fore in the World Parks Congress in 2014, and was led largely by the World Parks Congress in 2014 and led by pioneering organizations such as Parks Victoria, but the concept has traveled across North America, both the States and Canada, and other places such as South Korea as well. And in Europe, we decided the program was really fit for purpose here, but our parks and protected areas are very different to other parts of the world. And also our health systems. We have a great diversity of health systems across Europe too. So we needed a sort of high-level strategic program, which is captured in this document. And the vision for this program is a really neat, simple one: happier and healthy people, more connected to nature-rich, e.g. healthy parks and protected areas. Next slide. And at the time, we devised a program around 4 pillars. Interesting, in 2019, I think we still were putting a lot of work into making the case for, I guess, for green health and connecting people with nature to deliver health outcomes. That's probably less important now, but still is really important when parks and protected areas are taking up this sort of work. Second pillar was about building partnerships, particularly with the health sector, but also other organizations, transport organizations, education organizations as well. There was a need for the sector, the protected area family, to think about its capacity and the practice, and also for it to think quite hard about who it was connecting with nature. We obviously have a large number of visitors, but actually the health needs are probably people who aren't visiting our parks. So how do we connect those people with nature? So there are 4 pillars, and we've developed a toolkit which talks about the sort of practical implementations of HPHPe. And I guess a lot of this will be familiar to many of you on the audience, or at least 2/3 in the audience. So a lot of protected areas are doing this already, but is it really connected into health outcomes? So a number of things in here: development of more targeted and specific green health programs. So instead of a nature walk, why not a health walk? And actually doing that in partnership with the local GP practice and the health sector more generally. Perhaps more of a focus on not just healthy living, but also on specific health conditions and tackling health inequalities, particularly around physical activity and mental health. We're very good at delivering programs in the park community, but perhaps we're less good at monitoring and evaluation of their impacts, and particularly around health. So we need to do more thinking around that. Are we actually communicating health messages in our promotion of our areas? Do we have the skills and understanding in our staff? So do we need to build up on those? And I guess a very simple concept which we've adopted around 5 Ways Well, which is it's a simple concept based on I guess mental health principles, and it fits neatly, or bridges the gap really neatly, between delivering health outcomes and connecting people with nature and building that connection with nature that we need, not just for health, but also for people to value and look after nature more too. Of course, 5 Ways Well is only one of the sort of toolkits in the box. Next slide, please, Anna. And we're going to focus today a little bit more on a number of concepts about practice within woodland and forest settings. And on the screen, we've tried to resolve or define 2: forest bathing, which I think is I can't pronounce the Japanese, but originates from a different part of the world, but is increasingly being taken up in Europe. That's about self-conscious involvement in the natural environment through guided activities in a woodland setting. And then we'd also differentiate a second concept around forest therapy, which is, I guess, a much more structured approach or health pathway approach, which is looking to address specific health and social issues, and generally is medically led, either it be a psychologist or another person from the health sector. So two concepts in there. I think in different country contexts, you'll relate to them in different ways. And now we're going to hear, having set that up, just wanted another quick Mentimeter sort of poll just to see where the audience is in terms of forest therapy approaches. So can we just switch slides briefly? And then we'll go to the Mentimeter. So forest to health activity. Is your organization or entity, as it's described here, planning or implementing any of it at the moment? Good stuff. So again, we're getting a real range of yes, so from people implementing it. So we hope to hear from you during this discussion after the speakers, and also quite a lot of people know but interested in it. So we've got a really good, interesting mix of people. Hopefully that sets up the speakers nicely. Know your audience is always a good one for speakers at these events. I'm going to move on then to the first speaker, Pilar from the government of Catalonia, who has recently, I guess, adopted HPHPe. So thank you, Pilar, for doing that. Really exciting to have another person, another organization join the program, and we'll talk a little bit about that at the end. But I'll just hand over to you for your presentation about your journey in this area. Thank you.
So, good morning and hello to all of you. I'm going to share the presentation and please let me know. Okay, wait. And full screen. Maybe it will take a while. Okay, let me know.
Perfect.
Perfect, thank you. So good morning to all of you, and thank you for inviting Generalitat of Catalonia to present our case in this webinar. Okay, my name is Pilar Vendrell, and I am working in health and nature issues since 2023, although I've been working for the Generalitat in different fields for many years. And okay, this is the structure of the talk, a little bit of introduction, and then as case study, I didn't want to miss this opportunity to explain how we developed our health and nature program, where we are, and the proposed healthy and therapeutic itineraries. That will be the third point, our case study. And it's worthy to mention that, I mean, it's a work in progress. It was like meant to be done at the end of the year, but we are still under like the final draft and discussing it. So you will have the opportunity to see our like the first ideas, and that probably we will wrap it differently. So where are we? As you may know, Catalonia is located in the southwest of Europe and the northern shore of the Mediterranean basin, and is located between two geographical regions, the Alpine and Mediterranean. We have a very diverse terrain with several mountain ranges. So that means that Catalonia's territory has unique environmental conditions that create a high level of biodiversity. Although, as we are experiencing this biodiversity crisis, and for the past 14 years, the descent is about 24% in all the populations studied. So this is a general picture to present, and that we ourselves, and that it structures what are we doing and how. So in this map, you can see our system of natural protected areas. In dark green, you can see the natural parks that are declared by law. And in light green, other protected areas. It's worth to mention that the management of the natural parks are both from Generalitat and other administrations, as well as Diputació de Barcelona, who are several representatives here. And in total, we have 184 protected areas, which include Nature 2000 network, of course, and with the surface of more than 1,100,000 hectares. And this represents an average of 30% of Catalonian territory. So as antecedents, so you can see the image of our document, the Natural Heritage and Biodiversity Strategy of Catalonia. And in this document, we elaborated or is implemented the Health and Nature Program. But how it started? Everything started from the bottom. It means that other people were before us. So in Catalonia, there is a highly consolidated network of environmental and social associations. There are, of course, research centers. And it was in 2019 that a seminar was organized by a land stewardship network. It's called Xarxa de Conservació de la Natura, like Nature Conservation Network. And Peter, I thought you were invited there, or someone from Natural Scott. And also we had a webinar with the Japanese doctor to talk about Shinrin-yoku. And in that webinar was like the starting point of everything. We also presented some local initiatives from our research made at Hospital de Girona, Santa Catarina, some studies on fibromyalgia with 30 patients walking into type of forests, more mature forests and other more younger forests, both Mediterranean forest, which if there is here a lot of, people from all of Europe. The Mediterranean cases are, and our forests, as you may see later on, are quite different. And so after that seminar, which were the outcomes of that seminar? There was a declaration on the interdependence between health and nature in Catalonia. So that was the first time that publicly it was said that this interdependence exists. And that declaration said the pillars and the main objectives. One of these objectives was to create a health and nature board. So, and what is that? This is a space where everyone is welcome, either organization and people. And the members are those who signed this declaration. And after that, there was created a core group composed by a representative of the the four areas of the society: administration, civil society, research, and economy. So since 2019, and it was a bit before COVID, so everything started during COVID time, and so the meetings were like not presential, and it was like a slow starting. And since then, what have this Health and Nature Board done? Mainly sensitization initiatives, such as a web page. There is a newsletter presenting all these organizations and all these people that is working. These figures are from September, where we had the second annual meeting. So probably today there are even more organizations than 174, and more people sign. And having this board has facilitated us quite a lot, as it's difficult to get to know people outside of your own field, about out of the field of conservation. So we could meet people from the health administration and from other, both from Generalitat and from local administration. I mean, health and nature initiatives happen mostly at local levels. And this year, and everything is coordinated by a technical secretariat that we are financing in a annually financing well, in an annual financial of this organization, the Land Stewardship Network. So they are in charge of the technical secretariat, which helps a lot. And this year, smaller tables have been activated, and the initiatives are, this is not planned, so this is what organically is happening in the field. Some territorial tables in southern Catalonia, in Terres de l'Ebre, which initiative started from two natural parks, Parc Natural del Delta de l'Ebre and Parc Natural dels Ports. And the other one is from Girona, the city of Girona, after implementing a kind of green infrastructure program. And the other thematic tables are from a very defined issue, and one is about children, youth, and young adults. And they have a very lack of contact with nature, with all these technologies. So, and there is also a health problem derived from COVID. And the other that is still, it's not structured, but it will be a big challenge, which is health nature prescription. So, and even though not being like structured or organized from top down, at health centers, there are many initiatives to include nature or health therapies or health initiatives in their centers. Here is, I'm not going to explain all, but there are from community gardens, healthy path, changing patient attention protocol, creating therapeutic spaces. And as well, there are research institutions in Catalonia involved in Horizon 2020 programs. And their research is in nature-based social prescription. And another is expanding nature-based therapies to improve equity in mental health. And another more with the our cultural illness, which is sedentarism. So they are studying the metabolic syndrome and how therapy based in nature in 2 coastal areas can help. So here is not, as I will mention later, we are not focused only in forest, but in nature, in all the landscapes that we have. And so we have this on July 2018, the government of Generalitat approved the Natural Heritage and Biodiversity Strategy of Catalonia, which is the strategic planning document that defines our roadmap for nature conservation policies until 2030. And it's composed by quadriennial programs. And so in 2023, we started the second quadriennial program. So it was then that in the 6th area, the society engagement in the conservation of natural heritage, we included what we call the health and nature program. So in the operative objective, raise social awareness of the impact of human activities and the services provided by nature. We added 2 priority action lines. One is integrate the benefits of nature for people's health and well-being in our conservation policies, but as well in the set of sectoral policies. And the other is more about the governance. How do we connect with other actors, with other stakeholders to make all this possible? So when we designed it, we didn't think a lot about healthy parks, healthy people structure program. But after that and reading it, we've seen that we have contemplated all the pillars and all the objectives. So now one of the objectives is trying to, wrap it up in the way that is proposed by Healthy Parks, Healthy People. And so we contacted Anna and other people. So this is our project for next year. And so next slides are really not to read. This is just to show you in the different action lines, we have actions, we have objectives, and we have a chronogramma, so how to implement them since 2023 to 2026. So we are kind of in the middle, and the ones that are marked are some that I am going to explain later on, or briefly I will comment following this. And we have, so we started by, we think we have to have a conceptual state of the art. So what are we talking about when we talk about health and nature, what implies, and we have to communicate it within our general direction, and we have to explain it to the public and to the people. And so integrate it in environmental and volunteering programs, and also in the strategic plans that are elaborating our natural parks and other consortiums, which are other forms or organization and managing natural parks. So this is like waterfall planification, and that from this general strategy, it influences other strategic planning. So in this way, we make sure that everyone takes into account or includes this new action line, nature and health, in their programs. So this here, the target 64 is the governance target, which means reinforcing this health and nature board, but at the same time formalizing our collaboration with the health department. We've been in contact and in touch with them and knowing each other and our very complex organizations. You know, the health department is organized really from the central department to, you know, the primary health care centers in the municipalities. So it's very complex. And now we are on the way to formalize this conservation in a collaboration agreement with the objectives of deploy a nature prescription as a pilot case for community prescriptions. They were working of community prescriptions, which means the community assets that the community points out, and nature is one of those. I mean, they, instead of giving you a pill, they can tell you, okay, join this theater group or go to this group of people if you feel alone. So now there are the nature assets. So this is very, like, there is a process, and we need people resources, economical resources. So we'll see how we manage it. So the other is to improve the nature assets map to be able to deploy this nature prescription. Another objective is how to standardize the research outcomes from all these research programs that are, or projects, international projects that are taking place in Catalonia, but as well in their European projects. So we have to standardize, disseminate, and apply the conclusions. And another objective is to strengthen the governance and executive capacity of the health board. Well, this is a print screen of the webpage of the Health Asset Finder. So just going to the important part of the presentation, our case studies, the implementation of activities on the ground, network of healthy paths in natural parks, and training capacity building. So even before we plan from the office all these projects, there are happening things in the fields and in our natural parks. This is a set of activities. The logos are the logos of our natural parks, and the different kind of initiatives that are taking place are like multi-capacity activities and routes. Also, in the European Charter for Sustainable Tourism, there are the health and nature initiatives. In some places by the sea, they are researching and having pilot projects for blue receipt. In other natural areas, they are doing sensorial activities, mindful works, and forest therapies. So the starting point is also what was happening in the territory. What did we have? We had an hypothesis. We wanted to implement. We would like to implement nature-based health initiatives in the network of protected natural spaces, but considering what? Considering what we had to consider before, that there is a current serious problem of social use and overcrowding in nature in general, and specifically in certain places and certain times of the year. So we had to consider that in Catalonia, there is a network of forest itineraries with therapeutic functionality led by this association, Selvans. I will present Selvans later. We had to consider that biodiversity and nature must be preserved and restored. And we we would like to avoid a new extractive use or a view of utilitarian use of nature. So for us, of course, health is an asset, is a ecosystemic service of nature, but we wish to focus on highlighting the intrinsic values of nature, the values of the place, how to facilitate connection, not only contact with nature, but from another place, rather than providing health to people, being a transformative experience. So that's like the starting hypothesis of this project. So we had Selvans. Selvans is this organization that is working in conservation and land stewardship, more concrete forest stewardship. They promote the conservation of forests of high natural value with the aim of being able to protect 5% of the forested area of Catalonia. And so they began a health projects, and since 2013, Selvan has been working on the configuration and implementation of a network of therapeutic forests in Catalonia. We had to consider that. They have been doing training of forest bathing guides. They have made 3 editions of specializing course, and they are also working with the university, and as well they do some research. And the pillars of their project is the quality of this. They have a quality standard for forests with therapeutic functionality. So the quality of, they take into account the quality of the forest. That forest has to be, has to have a land stewardship. The itinerary facilities, they work with specialized guide, with the local stakeholders, and also in cooperation with hospitals or biomedical research programs. So you can see here a big picture of the different type of forests we have. As mentioned before, we are between the Alpine and the Mediterranean zones. So just in the Pyrenees, in the northern part, we have well, this mixture of broad-leaved Fagus sylvatica, Quercus, the Abies alba, and maybe more like central forests where this forest bathing began. So what do we do with our Mediterranean Pinus alepensis, open spaces, and our mosaic, our Quercus, our ilex, our mosaic of agriculture and other landscapes. So really now I am presenting you this study that we have worked with Selvans. And Anna, please, if you can tell me the time, how many time is left.
We are a little bit beyond the time, so just speed up a bit, but
okay.
But finish,
okay.
Because they're important slide, this one. So
yes. Okay. So taking into account these therapeutic forest itineraries and their characteristics, we have tried to establish, I mean, this is not a rule, it's still under study, it's a first proposal. What if we want to have healthy itineraries in all the diversity of our natural parks? How could they be? And so this is like the first characteristics to talk about. The distance can be longer. I mean, it's important to say that both itineraries are paths chosen to be walked with special conditions of tranquility and with a very leisure piece of progression, and that there are already many paths, so is which of the existing ones can be, I mean, transformed or called or used to this new health approach. So there are characteristics of elevation, maximum slow, duration. Of course, we need related service such as nature guides or mindful walks. And like the most important thing is the predominant ecosystem. In the therapeutic forest itineraries, of course, is mature forest, at least 70%, to maximize the benefits that this kind of forests are giving. But in other ecosystems, nature also has natural assets. So these health itineraries are more in a different ecosystems and in a mosaic. And the characteristic is the landscape, the variety of landscapes. And the activities there can be guided or not. And so the values to be worked in these itineraries are also a bit different. In the healthy, the main item is the trail. I mean, you walk through a trail that is existing trail. And maybe it's the sense of orientation, because we want to avoid Wikilocks, tablets, electronic dispositives that now it's people don't, when they go to nature, they don't look, they just look at the screen of the smartphone. So this is a new approach and a new intention, a different intention. So these health itineraries would also focus on socialization, a breadth of view, physical fitness, but not in terms of aerobic fitness, but in maybe other physiological physical fitness, the knowledge of the environment, the sense of fascination, and the manage to walk. I didn't know how to express. It's like not walks, you know, be able to walk in a way that you can appreciate nature. And of course, we are now, our challenge is how to integrate these therapeutical paths that already exist, but either the Selvans Association or we as administration, we can design newer ones with these other healthy paths that are more accessible to a wider target of people. And how do we guarantee an inclusive and sustainable governance of these two networks, how the management of them is comprehensive. And okay, we have some proposals of the planning, implementation, and managing some approaches. And so besides this, this project of implementing this network of healthy paths, we will focus next year as well in training and capacity building of our park staff, a general training, to be able to communicate these values of nature in terms of health. And also specific courses in our parks. There is a specific course called Good Connoisseur of the Park, addressed to people, entities, and companies who carry out or want to carry out their professional activity within the protected areas. So first, it's recommended, or if their activities are promoted by the park, they have to have done this course of knowing the place. So we will include a new module of nature and health. So, and this is the last one. Last Friday, we presented this guide that was elaborated by the Environmental Education Association within the table of children, youth, and young adults. And it is how to, the environmental educators can not rethink, but can add this health layer to their work. So, and well, this is a figure of an approach of the different activities which match a lot with the 5 ways of well-being, healthy parks and healthy people. And well, in this guide, there are also examples that are now carry on, and an introduction, the relation between nature and health, and is a little bit of the basic manual for environmental educators to start on. So thank you very much, and sorry if I took a little bit more of time. I always think I will be like less, but at the end it's I exceed the time. Thank you very much.
Thanks, Pilar. That was really fascinating and worth the extra time, I think. So lots and lots in there we could talk about for hours. I was actually at the XCN conference. I think I gave a presentation. So it seems a very long time ago. So it's really exciting to see the journey you've been on since and all the hard work you've put in. We've got a few questions. I'm just going to pick on 2 because we're just slightly short of time. So I think it's a colleague from Germany has hit the nail on the head. So where are you getting the money from for the activities that are happening in the parks and areas? So is it coming from, which bit of government is it coming from, or is it coming from somewhere else?
Okay, so the activities in the parks, they are both organized by the parks themselves, but the activities that the parks promote are also being given by enterprises, private guides, or associations and organizations. So it's both. And we as the central office, I mean, the parks have their own budget to decentralize from our central office.
Okay. And in terms of in Scotland, I suspect in the rest of Europe, our budgets are going down. So all the time. So again, you're squeezed. So how are you managing to protect the sort of core business of the organization as well as the health business of the organization? Is there a challenge in there?
Well, yeah, this is very challenging. I mean, even we as environmental department, I mean, different governments have been, you know, the environmental department was disappeared, and then we are joined with agricultural, and then we are joined with the political territorial political. So it's it's a challenge. We are working since 2015 to have a nature agency to be more independent, and even the both by financially and both by the procedures to be able to implement all this.
Okay, it's a challenge, I think, is the
Big
message there.
one. Yeah, I hope next time we meet the agency, I mean, 10 years, in the next year, it's expected to be a reality, we hope.
Okay, good luck with that. Final question I'll just pick up on was about monitoring and also risk assessment. So these activities are potentially dangerous or have risks associated with them. Is there a standard risk assessment approach that you've agreed? And I guess the other one is about, who's monitoring the health impacts?
Yeah, really, we we are not really monitoring. There are organizations that are, I mean, what do you mean by monitoring? Is monitoring the outcomes of being in nature, I think you mean. So we are not still not directly monitoring. This is something that is missing in the planification. So we had to add it. But there are organizations and research studies that have done some monitorings, and the challenge is really the risks, because we have a big dispositif, an informative dispositif, which is very difficult. How do you say? Administrative to implement of in certain areas like small ponds or in very particular places that, I mean, huge amounts of people meet. So we have in between different administrations, not only Generalitat, but also diputacions and consortiums. We have this dispositif to regulate access to nature. So this is why with designing this health and nature project, we have to be very careful not to add a new, wave of people going to nature.
Okay.
That's a risk. So we want to go slowly.
Okay, that's really helpful. And just to plug for next year, I think the Commission's thinking about doing something on monitoring or magic numbers, making the case. So watch this space. I see I've appeared on the video feed now, so there you are. You can see my beautiful face. I've got to move on. So thank you again, Pilar. And we're going to introduce Francesco and Federica from, I guess, a slightly different organization, Italian Research Institute, so a national research body.
National Research Council.
So I'll just hand over to you guys. We're obviously a bit short for time, so communicate as quickly as possible, but we'll probably overrun. So hopefully colleagues will be able to stay with us a bit longer as well. Just a warning that we'll probably run over we'll be on quarter two. So over to you two. Sorry to keep you waiting.
Federica.
Okay. Good morning at all. Can you see? I'm sorry.
Yes. Full mode. Perfect.
Okay. Good morning to all of you. Thank you to Anna and EUROPARC for the invitation. Yes, I'm Federica with my colleague Francesco Marizzo. We are researchers at CNR of Italy, Institute of Bioeconomy, and we are engaged in a forest therapy topic. Just a few considerations about the context. It's well known that in recent years, attention to restorative effect of the forest environment has been quickly expanding. So in Italy, as well as in other countries in Europe, numerous initiatives are spread aimed at promoting well-being through forest environment frequentation, named as forest therapy, sharing yoke, and so on. At the same time, there were the first signals of institutional recognition of the value of forest environment frequentation in terms of outcome for health. For example, United Nations recognized the frequentation, the forest therapies as a preventive medicine practice. And starting from 2016, there has been also an exponential increase of scientific study on this topic, so that now we can talk about a new discipline in research field, forest medicine. Despite that, most of the initiatives are not embedded in a rigorous scientific-based framework. Overall, we can see that forest therapy service system is still immature, no? And there is a lack of recognized standards, for example, on how to carry out activities for forest therapy, or how to choose suitable sites and other elements allowing desired health outcomes. Also for this reason, in Italy, we created a forest therapy network that involves Minister of Agriculture and Forestry, as well many universities from forestry, agronomy to cardiology department and other research center. The main aim of this network are, of course, the full recognition of the forest therapy as preventive, integrative practice within the national healthcare system, first of all, not by green prescription and other instrumental tools. And another aim is the definition of a national standard for criteria about site, trail, therapies, formation, professionals involved, and so on. And another aim was the creation of a network of qualified forest therapy stations according to objective and well-sound scientific criteria. With regard to green prescription, we recently presented a bill integration for the recognized for the introduction, the integration of forest therapy into the elementary essential level of assistance. This is a starting point, and we hope that green prescription can be a reality also in Italy. Sorry for. Oh, I don't know that. Okay. So very quickly, because many of these aspects are described by it in Pete's presentation. Forest therapy is, we intend a more structured approach, for example, respect to forest immersion, forest bathing. Now, firstly, it involves always the guidance of clinical staff, psychologists, psychotherapists, but also other clinical figures, professionists, for example, for a particular specific cohort of patients and of disorder. And forest therapy is conducted in suitable sites. So forest environments and sites were selected according to logistical needs, of course, so security, accessibility, and so on, and also based on the evidence of the outcome on the effects produced. So aspects and elements related to forest structure, natural features, pollution, and so on. Forest therapy is, of course, based on focalization on senses. And so the professional therapist enhance the connection with nature about focalization on senses, of course. And very important to note, to highlight that we can call therapy strictly sensu if the statistical significance of the effect are known. Effect also conditioned on the environmental and, of course, personal parameter. Socioeconomic, cultural, and so on. Allora, very quickly, the basic mechanism at the base of the effects. Of course, it's clear that all senses receive stimuli from the environment, translating it into psycho and physiological benefit. And many studies are focused on integration to isolate which are the main determinants of these beneficial effects. Of course, in open field, real life, real environment, is very hard to isolate the role of single stimuli, no? The role of visual stimuli, soundscape, dimension, other factor. In general, we can say that sound, landscape, and air composition are maybe the determinants relatively more easy to measure and to quantify. However, several numerous studies and experience identify some ecological forestry features and characteristics able of optimizing the restoration effect. This is just some indication. For example, as Pilar also said in the previous presentation, natural mature forests are better than plantation one. High biodiversity is very important factor for enhance improved effect. As well, the three species are different, affect differently the perception and the benefit that we can obtain by forest frequentation. In particular, with reference to emission of biogenic volatile organic compounds that are molecule very volatile, with released from trees, from plant, and from soil in different form and different trend of emission, depending of species. Conifer are the better in the world of with this regard. Other factor, ecological characteristic that improve effect is open and bright forest structure. For example, the presence of water is a very important element, as well the exposure. So sunshine at least between 9 a.m. and 3 p.m. and also presence of panoramic points, so the view of peaks of mountain, for example, and very important, the absence of mosquitoes, flies, and allergens, also allergens. So, for example, it's very recommended to avoid grazing areas because the absence of mosquito is not guaranteed for. So this is an important table about the evidence, consolidated evidence about effects of forest therapy based on the current knowledge, current scientific literature. In the field, we can see that in the field of psychological effect, sure is very, very consolidated. We can see that with regard to anxiety, depression symptoms, stress, sleep disorder, we have a study indicate, there are many studies, and this many studies indicate a very large effect size with a p-value less than 0.01, 0.01, which indicates highly statistically significant effect on anxiety, depression, stress, and sleep. This is very important. This is a very large quantity of studies confirming that results, both in patients and other in people with no declared certain pathologies. So it's very important. Also related to stress reduction effect, many studies also indicate the reduction of cortisol. a significant, large effect also in this case. It's very important because the cortisol is a normal stress, but recent studies show that cortisol have also an immunostimulant effect, so cioè immunosuppressive, sorry, effect. So the reduction of cortisol affect also immune system. So it's very, very effective, very wide, wide range effect. Other studies show there are sufficient study about, for example, cognitive decline and depression in cohort of elderly in particular, with interesting results, significance of point of view of statistics. So medium to large effect size also for with regard to elderly cohort for example, chronic obstructive pulmonary disease. Also, in this case, it's very, very, very important results. And we finally, I want to highlight some studies about disorder related to chronic pain as fibromyalgia and also asthma in children, in particular adolescent. In this case, in this field, there are few studies currently, but the results are very, very interesting and promising. So it's important to continue to that research continue to explore this effect affect many people. Another consideration about effect, the duration, the persistence of the effects. Overall, this scientific literature show that most effects, either psychological and physiological, show similar persistence. We can see that 3 hours produce effect for up 1 week, and 3 days produce effect for up 1 month. There is a consistency of studies. So, at the same time, beyond the effect, positive effect on health, it's important also consider the effect on cost saving for healthcare system, public healthcare system. The spread of forest immersion practice respond indeed to the opportunity for prevention and treatment to be integrated with orthodox health practice and treatments. Also in the context of the decline of public resources and incomes, and also by the increase in cost for families. So nature-based intervention are viewed also as a cost-effective wave, low-cost initiative to improve health, public health, and also provide cost saving for healthcare system. For example, briefly, in 2019, a study published on Nature showed that the global value of protected the global value of protected area, in taking into account only the effect on the mental health of people, of visitors, amount to 8% of global GDP in industrialized countries. It's clearly a very big amount of money of cost saving for public resource. And another consideration is related to link between anxiety, stress correlated disorder, and cardiovascular risk. Recent studies show that high level of anxiety provoke a 15% of increase in cardiovascular risk, so regardless of other risk factor as diet, lifestyle, and so on. So even considering the anxiolytic effect related to frequentation of forest environment, it's a very huge amount of disease avoided, and in terms of hypertension, stroke, and other cardiovascular disease. Finally, we are researchers, so we make researches. And in collaboration with Alpine Italian Club of Italy, we conducted a very large campaign forest therapy starting from 2021. This campaign was an experimental campaign of forest therapy sessions in about 15 sites across Italy, mainly in the Apennines, but all across Italy. We use urban parks as control sites, and in the campaign involved 2,000 participants engaged in 3 2-hour therapy sessions, guided, of course, by psychologists, following a protocol, a common simple protocol. And during the session, we realize also environmental monitoring, in particular about with measure of air quality, so pollutants, anthropogenic volatile pollutants, and organic bioactive molecule. And at the same time, we collected data from people, participants, about social demographic traits. And by using in particular two tools, psychometric tools, state rate and anxiety inventory, STAI, and profile of mood states, POMS, in order to collect reaction and results, outcomes about anxiety and mood, in particular, following the pre-post exposition to forest and to forest experimental sessions. So thanks to this very big campaign, we collected a large database with many data about people, concerning also not only social demographic characteristics, but also about lifestyle, diet, pathology, addiction, very amount of information that allows us to found interesting results that Francesco will be clarified and explain. So please, Francesco, thank you.
Yeah, can you scroll for me?
Of course.
Okay, wonderful. So I try to be fast because time is running out very fast. Okay, the most original results that we found from a part of the research we carried out since 2021 concern anxiety and asthma. Besides showing the high significance of the results on the reduction of anxiety symptoms and the asthma symptoms and the improvement of lung functions, we focused on what Federica said about one measurable potential determinant, that is the air composition, and in particular, based on previous literature and also previous works, about monoterpenes that compose the essential oils, the volatiles emitted by the plants. And very briefly, we found that the effect on anxiety, once one eliminates all the confounders, about 40 confounders, by means of a powerful clinical grade statistics, the propensity matching, arose a significant intense and dose-dependent effect with about a 30% reduction of anxiety symptoms due only to inhalation, to exposure to monoterpenes above a certain threshold. And this is very important. This is independent of anything else participant of the forest therapy session does during his or her experience. Well, for asthma, we performed a special investigation at an asthma care diagnosis and care center in northeastern Italy and Misurina Lake in Dolomites, and found very similar to anxiety a significant and dose-dependent effect of exposure of monoterpenes with very robust results, because these results were resisted to both simple exposure and personal inhalation of monoterpenes. This was really a breakthrough, because we didn't even expect such an effect. It was really a big breakthrough that opens really a world of possibilities. Next, please. Federica, next, please. Thank you. And the expectations about the monoterpenes were confirmed. This is very lucky, because they were confirmed about 1 month ago in Nature, from a big study from China's USA study about natural killer cells that let's say the first line of our innate immune system against microbial infections, that is bacteria and viruses and cancer, and in their section about the environmental contribution to natural killer cells functions. They found that alpha-pinene and other monoterpenes also synergically enhance the number of, and most of all, the activity of natural killer cells with very complex pathways. But this can be considered as definitive. No more doubts. This is the message. The exposure to monoterpenes acts like a drug. This is very, very important. And as Federico was saying before, in forest therapy experiences, and in general in forest immersion, the cortisol reduction that is inherent to this kind of experiences, independent from any other factor, is synergistic to the activation of natural killer cells, because cortisol is immunosuppressive. And this is very important, that its reduction reduces the immunosuppressive action and helps monoterpenes to activate the natural killer cells. This is very, very important. Next, please. So about and it can explain the results on both anxiety and even more on asthma results, because there is an inflammatory autoimmune and inflammatory condition. And the evidence, the historical evidence for asthma treatment concerns the benefits to pediatric asthma patients for at least 4 days, 2 weeks, stay at mid-high altitude alpine sites, that is 1,500 to 2,400 meters above sea level. And the problem in Italy is that the only remaining center, alpine center for diagnosis, treatment, and rehabilitation at Misurina Lake, closed at the end of 2022 due to economic problems. It's very, very complex. The historical is a historical burden. So we were the last to experiment there, and it was very very lucky to experiment in the summer 2022. But the opportunity arises with all this evidence that the isolated specific determinant of represented by plant-emitting monoterpenes allows screening other sites for suitability, complying with altitude requirements, and with air requirements, and possibly endowed by with milder climate, because you must consider that in end July at Misurina Lake in the morning there were 4 degrees. So we can next, please. Okay, so we experimented. We started with 2 sites in the Apennines, and the Apennines deliver. You know where are the Apennines? Apennines are from Ligurian region to Sicily. Very, very long mountain chain with moderate altitudes up to about 3,000 meters above sea level. With Etna volcano a bit more, with the average altitude about 2,000 meters, about 2,000 meters above sea level. And we experimented at Doganaccia site in Tuscany Apennines, a fascinating site in a state-owned forestry heritage, bordering with the park, the national, Tuscany Emilian National Park. But just bordering, because they decided many decades ago not to join. I hope they will revert to this decision. But we experimented a lot also in the national park. However, Doganaccia and Montescuro in southern Apennines, Calabrian Apennines, in the Sila National Park, a very, very fascinating site. And compare this with Misurina Lake, with long enough campaigns. Environmental campaigns, we found that pollutants, the so-called BTEX, volatile pollutants, at 90th percentile were lower in at Doganaccia, Montescuro, and by chance they were the same, about the same 90th percentile, 30 nanograms per cubic meter versus 50. And the monoterpenes were even higher, about double at Doganaccia, and 3 times higher in the 50th percentile at Montescuro. So they are, in principle, they are even more suitable for asthma treatment than Misurina Lake. Next, please. Well, at Doganaccia and Montescuro, also not only the environmental potential, but also direct potential on anxiety and in general mental health functionality direct on people. We experimented with large enough forest therapy experimental sessions. And Doganaccia did was striking. Probably the best results achieved across about 60 sites in Italy and 70 or 80 experimental forest therapy sessions carried out in 4 years. And we found not only this striking reduction in STAI anxiety index with high significance, but for males and females equally, but also a reduction of variance. This is very important because it is indicative of a homeostatic effect that sometimes, but only sometimes, has been observed, and this deserves further research. This is very, very important. At Montescuro, here in Doganaccia was performed in early August. Montescuro was performed in late October, if I remember well. Maybe the climate was not so perfect, even if acceptable but not perfect. And the reduction was of lower amount of reduction in STAI anxiety and total mood disturbance, but it was however significant, and probably due to logistic considerations in Sila, it is recommended for longer stays, which is suitable for asthma treatment because the minimum allowed stays is 7 days and recommended is 14 days. So it's perfect for each. Next, please. So, with the cooperation of Meyer Pediatric Hospital in Florence, of Bambino Gesù Pediatric Hospital in Rome, and local public bodies, governmental bodies, municipalities, and Union of Municipalities, parks, and the very large and powerful Let's Breathe Together, Respiriamo Insieme association in Italy, that you understand what it deals with, health campuses for young and also adult asthma patients will be launched both at Doganaccia and Montescuro in Tuscany and Calabria and Apennines respectively, starting in late spring 2025. This has already been decided. This very important achievement. By the way, in the map that Federica showed before across Italy, no problem, we remember, forest therapy operational services started at about at least 10 sites where local sections of Italian Alpine Club and municipalities and community organizations and so on supply regular forest therapy services with psychologists and psychotherapists that were educated and trained by us, by National Research Council and the Central Medical Commission of the Italian Alpine Club. Okay, this is another special forest therapy community project, the Forza project, Forest and Health. It is a community project in the Florence Mountains, in the Casentine Forest National Park, that has the double aim of providing health service and revitalizing local economies in marginal, internal, and rural areas. Next, please. Okay, they have performed 3 workshops, co-design workshops, tens of professionals involved, and 7 forest therapy sessions. Really more than 7 because some other sessions were performed in previous years. So about 10 forest therapy sessions and about 200 people involved as participants, and a lot of interviews with stakeholders, with beneficiaries, professionals, and so on. Please. Next, please. Okay, the forest therapy sessions, like all the others, like all the 100 of others that we performed, four steps of focusing on senses of sight, hearing, touching, and smelling, and a free step with where participants use their senses of choice, and very, very interoperable protocol, very simple protocols. Also, a few sessions with self-guided, that is with signposts, where people read the instructions, and so we are analyzing the data just in these days, in these months. The project will close in March. Next, please. Okay, another very important study by our partner, CREA, the Council for Research in Agriculture and Agriculture, Economy and Forestry. It is our partner in the national network for forest therapy, and they proposed a standard procedure for validation suitable areas. I strongly recommend to read this article that they published in a forest. You see the DOI here, but you find very easily a standard procedure and technical and objective criteria to assess the stationary and variable environmental parameters for the qualification of a forest therapy site. Next, please. So, definition validation process, definition of significant characteristics, geomorphological, ecological constraints, and so on. The forms that a candidate site stakeholders must fill for requesting the suitability analysis of forest therapy sites. And this will lead to standardization of forest therapy sites in Italy, along with the law bill that we are proposing. We are committed to bring this bill to approval in Italian Parliament for inclusion of forest therapy in essential levels of assistance, which will open the way to fiscal leverage and green and really effective green prescriptions. Okay. Further, and now this is last slide, likely for all of you. Further ongoing future special projects in Italy. These are projects already decided at 10 months long intervention with oncology patients, breast cancer in follow-up, so dedicated to women. This has already started and will finish next July. This is very important that we are very deeply committed with this project, and a 12 weeks intervention with patients affected by chronic pain. That, by the way, it was in Catalonia, Pilar, that this research started in 2015 and 2020. I don't remember the name, so I don't want to make some mistakes, but they made a very important studies that opened the way to this kind of interventions, and other projects that I cannot explain more because they are under negotiation, involving patients with different pathologies. Very important. However, to summarize, as Federica already explained very brilliantly earlier, established evidence for benefits to mental health, all dimensions of mental health, hypercortisolism, and pediatric asthma, and sufficient evidence, sufficient because studies are still relatively few, but evidence is compelling for hypertension, inflammation, and cognitive decline that concerns especially elderly, but even in middle age, unfortunately, for instance, myself, and evidence to be enhanced and finalized for other specific course of patients and pathologies. But here, the horizon is immense. And a first note, we think to be free to choose. For example, in forest therapy or this kind of natural care, really, we should consider that is compelled, that it is forced by the decline in resources that forces us to reduce the expenses, the financial burden on public healthcare system, and resort to very effective and forgotten ways to provide health. This is very important. This is, I would say, a big example, a very important example of what is forced by human ingenuity, challenged by the resource decline. Very important. Next. Thank you. By myself and Federica, our contacts, but the event will be published. So I thank you, Anna, and Jessica, and Pete, and everybody that has participated to this webinar. Thank you.
Thank you both. That was a real whirlwind tour with a very clear message about the health benefits of nature. And as you said, the I guess the forgotten art of health around engaging people in nature. And if we look back at most of our countries, a lot of this practice used to happen before the medical world became much more internally focused and, I guess, medicine focused. So really interesting presentation. Thank you all for staying on as well. We're losing a few people now, so it's I really appreciate you being able to stay on for both of those presentations. I haven't seen any questions for both of you, so I'm going to end the webinar just with a question for myself. So clear medical evidence emerging that satisfies the health world. What should parks and protected areas be doing in response to that medical evidence? Do you have views on that, Francesco?
What parks should do?
Well, yeah, what should they be doing?
Pilar showed that forest therapy sessions should be performed, forest therapy experience should be performed in major forests. This is very important. So parks should do what is doing the Tuscany-Emilian Apennines National Park. That is, of course, preserving and interventions should be genetically oriented, genetically guided, because only with genetically guided interventions on the forestry heritage, the future of forest can be ensured, and the forest can be safe, healthy, and become mature and self-resilient. Because you consider, for example, in this park that I know very well, where I have also, let's say, sponsored from a scientific point of view, the genetical interventions that now are very brilliant and very important. I say, sometimes I say that is the best, the most important intervention I have ever experienced. There is a silver fir, Abies alba, forest with the genetics of 55 million years, and it is resilient to every climate change, to every event, fire and climate change and any disturbance. And this is very important that autochthonous plants are planted and substituted and propagated and nurtured and so on. So this is the most important they can do. And for example, for forest therapy, it's very important, as Federica said before, that sounds are natural. So it's very important to avoid motors along the tracks, and even downhill that is according to me is really a tragedy. It brings some money but it destroys the experience, the downhill experiences. And grazing, apart that all herbivores, as you know, are errors in the algorithm of life. But apart from these general considerations that are beginning to be consolidated in scientific literature, but grazing is a tragedy for health experience because they bring the ticks and other insects that are almost about half of them are silly. They bring the Lyme disease and so on, but not only borreliosis and so on, and disturbance. We had a few forest therapy sessions that were destroyed by by grazing up to 1 week before, or even 15 days. So grazing and forest therapy health experience are incompatible, absolutely incompatible.
Thank you very much, Francesco. Lots to discuss in there. I think the key message there is about the importance of natural places for health, and I think that comes through, and that's clearly an important role for protected areas and national parks in whatever country in Europe you're in. So that's a really nice way to end. I think we should come to an end. Anna and I have been chatting offline, and we're saying next time we'll go for 90 minutes rather than 75 minutes. So apologies, we've been a bit rushed. We will circulate the presentations, and you will have a chance to reflect on them. And there's always possibility for more exchange with the presenters. We'd really like to hear from you. We did have another couple of PowerPoints which we won't show, but if you're interested in this agenda, if you think you're doing some of the stuff that we've talked about today, get in touch, tell us what you're doing. Join in the HPHPe LinkedIn group, and even submit a case study if you're interested in this area. We really want to hear from you and sort of grow the knowledge base and the capacity across the sector. So all I need to say then is thank you for the presenters, really interesting perspectives and a lot of detail to reflect on. Thank you for everyone who's joined. We've lost a few people, but most of you have stayed on, which is really great to show the interest in the subject. So have a good rest of the day. Probably take a walk in nature, if not woodland, next, and reflect on what you've heard. Thanks all. We'll see you all again before too long, I hope. Bye for now.